everyone, welcome back to my YouTube channel. I am Dr. Sue Cancer Vet, and today in this series of videos we are going to be talking about the top signs of cancer in dogs and cats. And the reason I think this is so important is, common questions that I get, things that people say to me after their pets are sadly diagnosed with cancer is, why didn't we catch this earlier? Is, why was blood work so normal in my pet? Many people, thankfully, and it's still really, really important, guys, to bring your dogs and cats to your vet regularly for routine checkups. And lots of these things that we're going to be talking about in these top 10 signs are things that I think can be picked up and will be picked up by regular visits to your veterinarian. But many people are so surprised because sometimes they still go to their vet on a regular basis and they're just shocked to find out their pets are still getting diagnosed with cancer. So, one of the things that is surprising is blood work can still be normal and our pets can have cancer. So in general, blood work is not a good screening test for most cancers in dogs and cats. That doesn't mean that we can't pick up certain abnormalities in blood work. Blood work is still really important. There are certain cancers like leukemias, which is cancer of the bone marrow, which we will see significant changes on blood work. Some lymphomas, we will see significant changes on blood work. So blood work is really important, but most of the time blood work can be really, really normal in our pets with cancer. So there are, tests that will often, we're often looking for blood tests. That would be great if we could screen our pets for cancer with blood work. But in general, that's not going to be a good way. Then is not going to be one of the top 10 signs of cancer is not going to be blood work. So we are going to go through the top 10 things, the top 10 signs, and these are things often that you can look for at home. Doesn't mean that your pet has cancer. If as you go through the list, and we're going to put up the list on the screen, if you see this, I don't want you to be like, oh my God, my pet has cancer. But I want you to be an educated, informed pet owner. You are your pet's advocate. So if you're seeing things on this list, that means talk to your veterinarian. And remember, I am not your veterinarian. Dr. Google cannot be your veterinarian. Your veterinarian is your veterinarian. So if you sense something is wrong, if you're seeing things on these lists, please bring your pet to a veterinarian. Don't email me, don't message me, don't send me a direct message on Instagram or Facebook. It's not because I don't care, it's because you have to bring your pet to a veterinarian. So let's do it, guys. Let's start breaking down the list. Let's do the top 10 signs of cancer in your pet. First tip that I want to focus on, and this is one that is so important to me, and I think it's also so important because it's personal and really, really difficult and tricky, and that is changes in appetite. And I'm also in this vlog going to refer to you some of my other vlogs and videos. And so in vlogs number 68 and 69, I talk about changes in appetite, but also give you lots of tips and tricks what to do when your pet won't eat. But the reason this is so important is, a poor appetite, and that could just be decreased appetite, not eating at all, but sometimes just not eating what they normally eat, sometimes is the first sign and the only sign that something is wrong. And it could be cancer, but it could be something else. So I don't want you, again, to freak out and listen to this and say, oh, my pet's not eating as much as they used to, they must have cancer. It could be kidney disease or other things, but it is often a sign that something underlying is going on. So I want you to be paying attention. Is your pet eating as much as they used to? So often that sign of cancer is a decreased appetite. In some cases, it could be an increased appetite, but more often than not, it's going to be a decreased appetite. Changes in appetite. They don't eat the foods that they normally did. So again, sometimes it's drastic and sometimes it's subtle. And hey guys, sometimes it's really hard to figure out because I had Jeter and Raz, two kitties, and my orange boy wasn't eating as much as he used to. But Raz, the little chunky monkey, was more than happy to finish Jeter's, share of food. So it was really hard for us, two boarded veterinarians, to figure out that Jeter was losing weight and not eating as much because the other cat was eating his food. So again, inappetence, poor appetite can be really, really an important sign to notice. And again, like I said, sometimes the first sign that we will notice that something underlying is going on, and a really good reason to get our pets to the veterinarian so we can start working them up, maybe, you know, doing some diagnostics, getting them on the scale, figuring out what's going on. And the important thing to know about is if you don't get that poor appetite treated, that can sometimes be worse than the underlying disease itself, because it can, you know, the immune system gets compromised. So it's really, really important. Things to look for, again, weight loss can be really, really hard in our fluffy animals. You know, sometimes they'll be losing muscle along their back muscle, their ribs will be more prominent, but in big fluffy animals, it can be really, really hard to sometimes notice muscle wasting and the weight loss. Sometimes they'll be smacking their lips when you give them their food. Their hair coat may be poor as well, and their behavior may be abnormal. But again, that poor appetite, changes in appetite can be really, really important. You may also note that they're nauseous, they could have vomiting and other gastrointestinal issues as well. So again, really important that we're looking for poor appetite. Again, not just cancer could be associated with it, pain from arthritis, other diseases such as kidney disease, heart disease, pain medications itself can all lead to poor appetite. So again, I don't want you to equate poor appetite with cancer. I just want you to talk to your veterinarian. I want you to get your pet to the veterinarian so we can figure out what's going on. That's the take-home message for changes in appetite. Sign number 2 is chronic weight loss or sometimes weight gain. More commonly, it's going to be weight loss than weight gain, especially if there's no change in their diet or their food intake, but your pet is losing weight. This could definitely be a sign that there is underlying illness. Again, not just cancer, things like thyroid changes can cause this as well. It's important that we weigh our pet regularly. Again, another reason to be, you know, getting our pets to the vet regularly. You know, you don't have to go in for an exam, but I'm pretty sure if you call your veterinarian and say, hey, once a month, you know, every other month, I'd like to come in and weigh my pet, you know, on the dog scale in the front or use the cat scale, give them a call first, but I'm sure they'd be happy to see you. I have had clients buy some cat scales off Amazon for their cats as well, because some cats, that's worth it not to have to bring them back and forth to the veterinarian. So something else you may see associated with that weight loss could be chronic vomiting or diarrhea. And guys, vomiting is really not normal, even in cats. I think often people say, oh, they just eat too fast, they're a nervous eater, they get hairballs. Vomiting is really not normal, and we'll talk about that as another sign as well. So it's really important, especially in cats, that we stop making excuses, especially for vomiting. I've seen all too often where cat owners, I mean, not to call you guys out, because I did it the same, and I'm a veterinarian, so I will always tell you guys where I have made mistakes along the way, but where we make excuses. And there's a really interesting study that came out a few years ago where they looked at cats that had chronic GI symptoms, and it was either weight loss, vomiting, and or diarrhea, or a combination thereof. Then they went on, and if they had an abnormal ultrasound and then went on and had surgical biopsies, 99 of the 100 cats that had chronic symptoms, had an exam, and then went on and had an abnormal ultrasound and then had GI biopsies, 99 of those 100 kitties either had inflammatory bowel disease or low or high grade lymphoma, more commonly low grade lymphoma. So again, just a really important take-home message that we need to stop making excuses. And what's interesting in that study, guys, of kitties is a quarter of them, a quarter of the 100 kitties, were going in for wellness exams, and it was the clinician, the veterinarian, who got a great history and noticed the weight loss. And in that study, I think it was a pound over a period of a couple of months, or chronic vomiting or diarrhea. And they said, this is not normal, we need to do an ultrasound. And then they had thickened intestines on ultrasound, and then they went on and had surgical biopsies. So again, just really emphasizing that vomiting, weight loss, and diarrhea are not normal and could be signs. Tip number 3 is enlarging or changing lumps and bumps. Guys, you know I feel really strongly about this. I probably should have made it number 1. So lumps and bumps, right? That's my thing. So please watch my recent video, which is at the top of, well, I shouldn't say it's at the top of the page because I move things around on my page. But you know, detecting cancer early in dogs and cats, vlog number 73. So for me, you know, doing your monthly lump and bump check is so important because we want to find lumps and bumps early. So I have lots of videos, guys, but definitely check out vlog 73. We need to be very proactive. We do not want to keep an eye on a lump or bump. So see something, do something. If the mass is the size of a pea and been there a month, we need to do something. We need to go to our veterinarian and we need to do an aspirate. I can't look at a mass, you can't look at a mass. Do not email me or send me a picture or send it to me in direct messages and ask me what that lump or bump is. We need to do an aspirate. So it's really important that we track those lumps or bumps. Guys, in vlog number 73, I talk about my skin maps. These are downloadable PDFs that you can print out from my website so you have, you know, something that you can keep track of these lumps and bumps. I want to make it all as easy as possible, but once a month, guys, check your dogs and cats for lumps and bumps. So we know that we need to be keeping track of these lumps or bumps so we can be very proactive. We want to find cancer earlier when these masses are small. Most skin and subcutaneous masses can be cured with surgery alone if we find them when they're small. And guys, you are with your pets way more than your veterinarian, so you're on the front line. I need you to be feeling your dogs and cats on a regular basis so we can find these lumps and bumps sooner. I see so many dogs and cats with tumors that are beyond surgery, and it makes me crazy. And that's why I did this program, See Something, Do Something, Why Wait, Aspirate. If you watch vlog number 73, you'll see how simple and easy it is for a veterinarian to do an aspirate. So please, guys, help us, the veterinarian, help you with those lumps and bumps. So important that we feel them. And again, so if the mass is the size of a pea, which is a centimeter, it's about the same size as a Skittle or an M&M, so lots of everyday objects, half the size of a penny. So we want to find these lumps or bumps when they're small, and we want to find out what they are before we have them surgically removed. If they're benign, your veterinarian and you can be a little bit more, you know, maybe not have it removed right away, and they can give you some more specific guidelines. But if it's malignant, like a mast cell tumor or a soft tissue sarcoma, they can make recommendations about that as well. Other lumps or bumps that I want you to be feeling for, and again, we talk about that in some of the other videos, are mammary masses or breast cancer. So dogs have 10 mammary masses. So I show you in one of my other videos how to do a mammary exam or a breast exam, and that should be part of your monthly exam. So that's going to be really, really important that you're doing your monthly exam, and that is in vlog number 60. So I show you how to do your monthly exam for dogs and cats. Cats have 8 mammary masses, so you want to do that as well. The good news with dogs is that 75% of their mammary masses, their breast cancer, will be cured with surgery alone. So that's great news. Only 25% of dogs with those malignant cancers will go on and need chemo. So 50% are benign, 50% are malignant, and half of those malignant ones are cured with surgery, especially when we find them small. So help us help you find them when they're small. Kitties are a little bit different. Have a higher malignancy rate, about 80 to 90%, and they do have a, they usually do need chemotherapy, but size is still so important. So again, really important that we're finding them around the 2 centimeter mark, which is really, really important. So again, really, it's important that we're finding them when they're small. The other lumps and bumps that are really important that I want you to keep track of are your dog's lymph nodes. Cat lymph nodes, you can definitely watch this part as well, but kitty lymph nodes are really hard to feel. So we have lymph nodes for dogs and cats under their jaw. Those are the mandibular, in front of the shoulders are the prescap, and behind their knees are their popliteal. So it's not really useful for me to show you where they are. So I have a great video, one of my most popular videos on YouTube is where are my dog's lymph nodes, the lymphoma section, and everything you need to know about pet cancers. So I show you where your dog's lymph nodes. I also have another video in the same sections about what it looks like when we actually aspirate a lymph node. So those are other lumps or bumps that you can be monitoring for at home. Lymphoma is a very rapidly progressive cancer, so that can be one where you've been at the vet a couple of weeks ago and then will develop really quickly. So if you can kind of get an idea where your dog's lymph nodes are, I think that that would be a great idea as well. That wraps up part 1 of the top signs of cancer. I hope you found it useful. You know what I'm going to ask you to do? Please subscribe. Tell me which ones you thought were most useful. What other tips could I put in there? Comment below. Don't forget to share. Thanks so much for joining. Please come back for part 2, where I give you the rest of the top tips and the signs to find cancer earlier in pets.